also on target. Alright, you find details of that on page 6 of the Punch Sports Extra. Monday, Babajide Power Tenerife past Sevilla. Okay, you find details of that also on the Punch Sports Extra this morning. And on page 4, we have the story. Villa gets £40 million Rashford permanent deal option. Will he take it or not? That's the question you find answer to on page 4 of the Punch Sports Extra this morning. These and more stories you find on the Punch Sports Extra this morning. You have an interest.
One has stolen my interest since you decided to open with "I'll be back." He's also talking about a Nigerian who also showed yesterday at the Grammy Awards. That's Thames, Temilade Openi. Thames also stealing an award right there at the Grammys for Best African Music Performance. Interesting. Congratulations.
That'll make the third one for her.
To rise and shine.
Yeah.
The global stage as such.
So, Nigerians, I think that's the word for us. I'll be back. When it seems it's not working, just tell yourself, I'll re-strategize, I'll try again, and I'll be back. All right, we'll be back shortly. Don't go away.
Leadership is not a package where you take it and say, here it is, I give you the package. Leadership comes from what you do, how you do it, how you live, what have you acquired in terms of your training, your experience, your track record, and all that. And what I'm saying is that Leadership is not a package where you take it and say, here it is, I give you the package. Leadership comes from what you do, how you do it, how you live, track record, and all that. And what I'm saying is that the young people must strive. Leadership is not a package where you take it and say, here it is, from what you do, how you do it, how you live, what have you have acquired in terms of your training, your experience, your track record, and all that. And what I'm saying is that the young people must strive. They shouldn't expect it to be a parcel delivered by DHL to them. And they must know that nothing comes just for nothing. You work for it.
Nice to know you're still with us on AM today. And as we promised before we went on that break, that will return, we'll bring to you our topic for discussion for the day. As one of the headlines we took this morning on some of the dailies, we read that there's the outbreak of Lassa fever, for instance, in Plateau. Two cases were confirmed, and Ondo State has not been immune to the occurrences of Lassa fever. It does happen sometimes seasonally. We have outbreak of Lassa fever in the state, but recently it seems is defiling the trends of being seasonal to being something that is almost having incidences or having records of it in our hospitals, for instance, almost around the year. Well, that's what we'll be taking a look at today, sensitizing you on the outbreak of Lassa fever in Ondo State, because there have been records of some fatalities in the state recently, and seems on the national record of NCDC2, Ondo and Edo seem to be topping the list of states with increased incidences for the year 2025. For instance, in week 2, the number of new confirmed cases increased from 54 in the epic 1 week of 2025 to 89. These were reported in Ondo, Edo, Taraba, Bauchi, Gombe, Kogi, and Ebonyi states. So there is need for you to be aware of what to do and all of that. And this morning we will be joined by a seasoned health practitioner. Is a disease surveillance officer that will be joining us on the show this morning to talk about it, especially as it relates to Ondo State, what efforts have been made, and how we will be able to read our homes, for instance, of causative factors. And
Yes, Shade, just talking about Lassa fever, if anyone is truly, in tune what is happening around society, you must have heard that word Lassa fever. But of course, the conversation around how it happens and how it eventually arrives at this time when you take a look at the development here in Ondo State. I'm looking at a report by Data Fight from 2023 where the headline says Lassa fever thrives in Edo, Ondo, and Bauchi states in the past 5 years, and says, taking a look at that breakdown, says Ondo, Edo, Bauchi, and Kogi, and Ebonyi still have the highest prevalence of Lassa fever in Nigeria. And that was a 2023 report by Data Fight, and it also included the the origin of Lassa fever now, particularly where it was first discovered or recorded in the country. It says, taking a look at Lassa fever, says acute viral disease transmitted by the common African rats and its animal born. The disease was Nigerian citizens and all of that. So for Lassa fever, that conversation we will be having. I understand recently there were officials from the Nigeria Center for Disease Control and Prevention here in Ondo State. We get insights to what the conversation is like around in Ondo State on Lassa fever, what the efforts are also like, particularly to ensure that we rid the state of Lassa fever going forward. And some of the activities that we must imbibe, or some of the precautions we must imbibe by the citizens, by the health practitioners themselves, and all of that.
And awareness can never be too much, because everybody have to be on the lookout. Everybody have to be out alert to make sure that, especially in families, in schools, for instance, boarding houses, and all of that, there is need to take preventive measures. And as I said, in total of 2025, that's 2025 that we just got to February 3rd, as of today, says 7 states have recorded at least one confirmed case across 32 local government areas. Of these states, most especially in Ondo, Edo, Taraba, Bauchi, Gombe, Kogi, and Ebonyi states that we mentioned earlier. So 7 of the local governments, have recorded. As we are not practitioners, just an overview of that for you to know what it's in the offing, on in that regards this morning. So without seeing this, joining us this morning for the show is health practitioner will be joining us, Mr. Bakari Adebayo Matthew is an Ondo State Primary Health Care agent, the surveillance officer there. This is surveillance officer. All right, Mr. Bakari, good morning.
Good morning, ma'am.
Okay, yes, we'll be talking on Lassa fever and the incidences in those. You're a surveillance officer. Can you give us an overview of what it's like now in Ondo State?
Well, thank you, moderator and viewers at home. Like you preambled, Lassa fever is acute viral hemorrhagic fever. It is called viral hemorrhage, which is bleeding. And if anybody starts bleeding, the chances of survival is very, very slim. And it is good for the people in town to know that Lassa fever is in Ondo State, and it has occurred in it used to be 5 local governments, but this year we have recorded Lassa fever in 8 local governments, meaning that it is spreading from one local government to another. It used to be Osrc local government in the past, like 6-7 years ago, where it is endemic in Osrc local government. Gradually, it moves to Owo, from Owo to Akure South, Akure North, Akoko Southwest, and in the recent time, Idore, Ifedore, and also Ondo West. So we can see that the rate at which it is spreading is alarming. Like you rightly said, in Ondo State, this year alone, we have recorded over 100 confirmed cases in all of these local governments. And this is making the government of Ondo State to be worried, and they are being proactive towards making sure that they, reduce the scourge of Lassa fever in Ondo State. Like you said, RRT have been deployed from national to Ondo State. RRT means Rapid Response Team. So they are here to support us. As a matter of fact, Ondo State also have their RRT in place. It has been activated by the Director of Public Health, Ministry of Health, in person of Dr. Stephen Fagbemi. We are working on a daily basis to see that the cases reduce drastically, and the number of deaths too, that they are reduced. Yes, people died of Lassa fever. And why do they die? Most of the time, the signs and symptoms of Lassa fever is synonymous to just ordinary malaria, where you have fever. If you have malaria, definitely your fever will go up, and you have body pain, malaise, and all that. People may not immediately think of Lassa. And let me tell you this, before anybody goes to seek health care, they would have tried on their own by probably going to chemist shop to buy this and that drug. It is when it seems not working that they will now go to seek health care. And all those periods they are doing that, the time is ticking, because Lassa fever has 21 days incubation period, within which anything can happen. So when people now get to seek health care, those people will also want to first of all treat malaria. It is when it is not working that they will now think of Lassa. And meanwhile, it is not all.
that have high index of suspicion for Lassa fever. They will not even think Lassa. They may be thinking sepsis, thinking some other thing, bombarding that patient with very strong antibiotics. It is most of the time when it's getting late that they will not think of Lassa, and when that person is being taken to the treatment center, it's only God that saves such a person because it is presenting very, very late.
All right. From your responses, I want to say you're a surveillance, disease surveillance officer.
Yes.
Are you doing anything to research or look into why this the epicenter is spreading now? What's responsible? You know, the rodents that causes Lassa. Is it that they are increasing and migrating to other areas, or are there other factors now responsible, different from the initial ones?
Thank you very processing people, those ones who have dried their garri and spread it on the road, and when they pack it in the night they just dump it, and rats will go there to feed fat on these food items, and they will still bring these food items to the market for people to buy. Before you can buy a quality garri, you want to have a taste first. You put it in your sweat droplets, blood to blood, it can be transmitted.
Just by way of asking, does this virus, can it be killed? Maybe you talk of people going to the market now and they want to taste garri before they purchase. But what if it goes through maybe cooking? Will it die in the process?
Yes, it can die in the process. Like I said from my example, garri, even it is when you make eba that you heat it up, but you can soak just
We
eat
do
it
that
raw.
commonly.
Commonly. So those are the issues that we have with our grains, most of them.
All right, Mr. Bakari, let's break this conversation further down, because you've rightly mentioned that it is spreading. Looking at the facts, the statistics, and the data that you're working with, when you take a look at from 5 LGs now to 8, and the question will be, previously, health practitioners like yourself are usually very minimal with information as to where some of these issues are taking place. They tell, okay, where are the local government? We don't want to mention, so that they will not discriminate and all of that. These are part of the instances that we've, why trying to get information out. But isn't that to be said that that strategy is not working? That strategy of minimizing information as to where these incidences are occurring. Because at the heart of this is also about attitude of people, how it can change. Don't you think going forward there has to be an all-out approach to say, look, it is happening here. The people here also have to be very conscious. Anybody who is coming to these areas also have to be very conscious. Don't you think that is the way to go to reduce all of the cases that we're getting at this time?
Yes. Of point, we are all out. Like I said, all our hogas under the leadership of Dr. Fagbemi, the public health director, my able director also, Dr. Adefesoye, the disease control and immunization director. They are all working in such a way that they want everybody to be aware. It is what you know of that you'll be able to prevent. Like I've mentioned local government, Osrc, or Idore Akoko Southwest, Ondo West, so that people will be cautious and understand the fact that this virus is with us, and we have a whole lot to do in order to reduce this scourge. And sensitization is ongoing in all these local government. Even Ondo State Primary Healthcare Development Agency is kickstarting community engagement from this week in all these endemic local government. They are kickstarting community engagement to talk to people about Lassa fever and to also create awareness in the community.
Mr. Bakari, a lot of persons listening and watching at this time would say, look, we've had this conversation around community engagement.
Thank you. The community engagement is a new strategy. What we usually do before is just sensitization, whereby we go to the community, we talk to them about Lassa fever. But now we want it to be a community lead approach, so that they will even be the ones suggesting to us what should be done. Number one, we need the cooperation of people in the community, because like we discussed behind the camera, when you are telling somebody that, oh, we are suspecting Lassa, the first thing that person will say is, God forbid. It's because you are sick. That is why you are presenting in an hospital. And if some of them, they are tested positive, and you now, humbly tell them that your result is out and you are positive, please come and move to treatment center. Some will refuse. Some will even curse you and be raining curses on you. Meanwhile, governments of Ondo State have put in place free ambulance to transport people that are positive to treatment center. I repeat, treatment center. It's not all the hospital that treat Lassa. In Ondo State, we have Federal Medical Center, who is the major lead in the treatment, and we also have our infectious hospital here in Akure, former IDH, where they attend to infectious diseases, and one of them is Lassa fever. They admit and they treat, and people get well. Also, St. Louis, which is private, is also co-opted in the treatment of Lassa, and the treatment is free. There is drug to treat Lassa fever. If that patient or case is presented early, the person will be treated and he will go back home alive. But people, you will have to persuade, beg before they can go to treatment center. This is worrisome.
Mr. Bakari, so we know there are symptoms. Are there also tests to be carried out to ensure that you be able to ascertain that this is Lassa fever? But perhaps this should be the first point of call for anybody who comes now, presents symptoms of headache, just like you mentioned, malaria, and all of that. There should be a provision to say we want to test for Lassa. Is that also in place?
Yes, and the test also is free. Okay. It is blood sample that they collect from this patient, and they to FMC or what is the only facility in Ondo State that carry out such tests. And very soon, Ondo State also, the IDH Infectious Center will also kickstart, but they are waiting for approval from the national to carry out this test. The test is free.
Okay, that's a good one. That you mentioned earlier in your explanations that there is a period of 21 days, incubation in the body of the patient that is infected with Lassa fever. And looking at the treatment pattern, when patient gets to the hospital, you first suspect it could be malaria and all of that. Is there no need of, or don't you think if all patients that come to the hospital are suspected of Lassa in the first instance, maybe this could help in, fast tracking the treatment and, preventing death occurrence?
Yes, you are very correct, ma. We are in an outbreak. Emergency has come to stay with us. So in emergency period, we always think of Lassa first. Like I said, before anybody present him or herself at the healthcare facility, that person must have tried something on how his or her own at home, even locally. It is when it is not working that we now present ourselves at various health facilities. So now that we are having an outbreak, that is what we are preaching to our medical personnel, to at least, nobody say you should not treat malaria, but collect sample first for Lassa fever and send to lab. If it comes negative, you continue your line of treatment. If it is positive, quickly we take the person to the treatment center to save life. We don't want to be recording it bleed the heart of the governor that people are dying on those states of Lassa fever, and that is why it's responding very well to this outbreak that we are currently having.
All right, Mr. Bakari, now let's practical wealth of experience as a disease surveillance officer, because I'm also imagining that you've had opportunity to go to some of these communities where we have the cases coming from. What exactly appears to be the driver of these issues? What are some of the challenges you will face in terms of what you meet on the ground?
Maybe the way of life of the people
in some of these communities. Tell us, Mr. Adebayo.
That's a very big question, because our surveillance team used to be resisted in the community when we go out, because when there is positive case, there is something called contact tracing. We will need to contact trace people that had contact with that particular case, so that, number one, we want to monitor them for the period of 21 days, which is incubation period, to see if any one of them will develop symptoms. And if they do, we quickly respond by collecting their sample and ensure that they go for treatment. If you go to the community for this activity I just mentioned, some will not even, you will call their phone number, they will not pick. Some will give you a fake address. To trace these people will be very, very difficult. And if you get to their houses, they will resist you most of the time. That is why I said community engagement, that we need to engage them, to let them know the enormity of what we are dealing with. It costs life.
Mr. Bakari, have you had instances where in the process of contact tracing there has been resistance, and maybe that individual or that the group of individuals that resisted, they eventually fell down for Lassa fever? Have you had that instance?
Even some people that refuse treatment, that refuse to go to treatment center, some died at the end of the day. And it is appalling for somebody to be dying of a disease that has cure. It is just purely ignorance.
All right, so as we maybe wind down this conversation, please tell us, you've mentioned 8 local government areas in Ondo State, where we've had 1 or 2 incidences of Lassa fever. From 5 local government, we've expanded to 8 at this time. And the question would now be, in each of these local governments, do we have peculiarities, or do we have, what are the differences in terms of the drivers? You mentioned rats. Is it the way people keep their food? Have we detected a source? Maybe there is a major market, or there is a major producer of a certain commodity that appears to be also be giving life to all of these Lassa fever outbreaks in each of these local governments. Have we been able to detect the source of these issues?
Well, for now, we have only been able to pin it down on these rats that we talked about. Like I said, every local government have their own RRT. As they have in national, we have in the state, and we also have our rapid response team in each of local government, and they also have disease surveillance and notification officers in all the LGA that respond to all these outbreak. But at the moment, the main culprit for Lassa remains this rat, and that is why we are, campaigning for deratization. Government has done deratization in most of these local government last year, and I'm sure it is also in the budget for this year in order to reduce this rat in our environment. They are really doing much, but the only thing we can pin Lassa fever on now is this rat.
How do we ensure that the remaining 10 local government areas that we've not had, because we have 18 here in Ondo State, they do not fall to this outbreak? What are the strategies?
Surveillance is the answer. Like I said, it migrated from Osrc to Owo and like that. And our testing capacity should be increased, because we have interaction on a daily basis. People from the southern senatorial, they come to Akure, to Owo. So if we really carry out tests as expected, we may likely found this. So people are dying and we don't know the cause. It's just that our testing capacity is low and limited to this local government. That is why sensitization was carried out last year, sensitizing health workers